Okay, hi, hello all, and welcome to the third annual EcoHealth Global Summit 2025. We're so excited to have all of you here today for the Asia session, which is also the last session for the summit. My name is China, I'm based in Malaysia, and with me is also JP from the Philippines. And we are both veterinarians and early career researchers who are passionate in One Health. And in this call, we also have from our team Angel, Halas, Christina, who we have been working for a long time for the past few months, running this global summit in many regional sessions. So this Global EcoHealth Summit was created in 2022 by Dr. Margaret Parks, Chair of the EcoHealth International External Advisory Group, and Dr. Angel Kennedy, who's also here today from Simon Fraser's University. And it began as a space to foster ecological and equity-informed innovation, integration, and global collaboration to improve health for all. And this work not only requires knowledge, but relationship, trust, and deep care across regions, disciplines, sectors, and generations.
And yeah, the summit sparked from desire to cultivate intentional connected spaces. And these spaces is where we move beyond discussions of just health and sustainability to transforming them into practice collaboration, honor diverse knowledge systems, and supporting one another in navigating complex and overlapping challenges. And our Earth Hug highlights the importance of building relationships and fostering collaboration. It shows how care, support, collective effort, and exchange of ideas can contribute to a healthier, more just, and sustainable future for all. And it is reflected through this year's theme, working together for a healthy, just, and sustainable future. So we're really proud to host Earth Hug as an annual global summit. And of course, we look forward to connecting with you, everyone, way beyond these sessions.
So, in the past 72 hours, we featured an incredible group of thought leaders, career colleagues, activists, professionals, and researchers across 6 regional sessions from the Middle East, North America, Turtle Island, Oceania, to Africa, Europe, and Latin America. And as we come into its conclusion, we're now in the Asia session with a theme of building resilience against spillovers through Asia's lens. And here we aim to showcase the key public health and zoonotic challenges in Asia, amplify the ground-root perspective through voices from locals and organizations working closely with the communities to look at systemic challenges in spillover prevention, foster creative and innovative solutions, strategies around spillover prevention and response through an interactive workshop, and also to give this platform as a chance to facilitate networking and collaboration opportunities, particularly for early careers like us. So, as part of this being a connected conversation, we will tune into a quick synthesis from Angel Kennedy about the conversations they had a couple hours ago in Latin America to inspire the next session of this global journey. Over
Thank
to you.
you. Thank you so much. I'm so excited to be here on this last arm of our Earth Hug journey, and thank you to all for joining. We've spanned so many different regions around the world, each talking about this overarching theme of working together for a healthy, just, and sustainable future, but taking their own lens and kind of feeling in each region, really grounded in regional realities. So, in the Latin America session, thanks to Carlos and to Christiana here, we held a trilingual session in Spanish, English, and Portuguese. And it really touched on all of these important ideas around transformative approaches to health and environment challenges and inclusivity, and really fostering social change through collaboration. And then there was a really interesting land body territory mapping activity that really brought in the value of art in working across generations in this work. So thank you so much. I'm excited for this session.
Okay, thank you, Angel. So we will start with the rundown of today's session. So with the exchange session, this is where our speakers will bring in rich experiences from practice organizations and academia. Then we also have the the Engage session, which is an interactive Q&A where we want to encourage everyone to engage with our panelists and fellow participants. So feel free to leave your questions in the Q&A box or reserve them after all the four speakers have presented. There is also a 1 hour break after that, and we'll move to the Empower session where you'll take part in a workshop, and it's a group activity designed to foster collaboration and shared learning. So please note that a Google form will also be shared in the chat after the session, and it contains some reflective questions, and they are not graded. It just helps us to gain deeper understanding of the context across Asia. And if you'd like to have a certificate of participants, you can also request one in the Google form or send us an email. And we'll leave all this information in the chat, so no worries.
Okay. So since we're a very intimate group, we can move to engage. And, I encourage everyone, feel free to introduce yourselves in the chat, share what you're working on, where you're from, and feel free to even open your cameras. So now we will be moving to a Mentimeter. If I guess most of you are already familiar with this, I'll be copying something in the chat. So here. So for our participants, please click the link. You will be redirected to a screen where you could input. Tell us, what is One Health for you? We'd love to know. So let me know if there's any issues in accessing the Mentimeter. Then we can copy. Yes. Okay. We'll post this results in the Padlet later as well. So feel free to type in what you think, One Health, and let's set the tone.
Okay, so we've gotten some responses. Thank you very much, everyone. And so many of you mentioned that One Health is for human health, animal health, environment health, and health is for all living beings. And we are recognizing that everything is connected, and that in this reality for all the humanities other than human beings and the planet that we live in. And One Health is the joint planning and action and response approach across cross-sectoral health agencies at various levels, the national, regional, and local levels. And it is also, One Health is understanding that we are all connected with our own individual health that is deeply rooted and connected to Earth. Very holistic answers, I would say. Right, JP?
Yeah, so thank you so much for posting your answers. We'll be posting this in our Padlet, and feel free as well to contribute on that Padlet. So I'll stop sharing and we can move on to our speaker session in China.
Thank you, JP. So we have four wonderful speakers today, and this webinar will be recorded and will be shared to all of our participants later. So it's my honor to introduce the first speaker, who is Professor Dr. Latiffah Hassan, and she's the Professor of Veterinary Public Health and Epidemiology at the Faculty of Veterinary Medicine, UPM, and is currently based in the College of Veterinaries, College of Health Sciences, University of Missouri, US, and with over 2 decades of experience in teaching, research, and One Health workforce capacity. Her work focuses on zoonotic diseases, food safety, and antimicrobial resistance. And Prof. Latiffah also played a pivotal role in enhancing the One Health capacities in Malaysia and Southeast Asia by leading intersectoral engagements and training initiatives. And she has also served in various consultative and leadership roles in the region and spoken in high-level forums. So she is currently the co-chair of the Lancet Commission on Prevention of Viral Spillover and is the coordinator for the Malaysia One Health University Network. And Prof. Latiffah holds a Doctor of Veterinary Medicine from UPM with a PhD in Vet Epidemiology from Cornell University. So let's welcome Prof. Latiffah. Thank you, Prof.
Thank you, China. Can you hear me okay?
Yes, very
Okay,
clear.
let me share my slides. I can't see my slides. Okay, I got it. All right. Well, thank you for the kind introduction, China. That was a little bit long, but thank you. It's good to see everybody.
Very good to see you, Prof.
I don't know whether I'm a suitable person to be talking about Asia, and I'm sure today we're not represented by everybody in Asia. We're a little bit limited in number, but that's okay. I like small groups so that we can have a better discussion. So I'm going to try and talk within the next, 9 minutes about Asia's pathogen spillover, and self-determination. Just to frame my talk, I'll give a little bit of overview about Asia. We love Asia, right? We are so beautiful, we're so rich, and we are so diverse. Just looking at the pictures around the room, I'm sure if you can see each other's faces, you see that everybody's very different. And then I'll go into emerging zoonosis in Asia and pathogen spillover concepts and managing the next pandemic, going upstream and tackling the roots. How do we do that? And where do we start and what do we want for our future? This is a big question for Asia because of our diversity, there comes challenges, and with challenges there comes opportunities, right? So we are 48 countries, each of us, each with its own unique political, economic, and social landscape. We speak over 2,300 languages. I don't speak 2,300 languages, but obviously, all of us, a cumulative number of languages spoken in Asia is that many. Wide spectrum of political structures, from democracies to authoritarian regimes, home to vast numbers of indigenous people. We host hundreds of millions with diverse cultural practices and really rich traditional knowledge systems. And Asia covers about 29% of Earth's total land mass, but there live 4.9 billion people, which is about 59 world population. So we're pretty dense, and we're pretty compact. We really inhabit Earth basically. But with that enormous diversity, we face a complex challenge, right? Hold on, this is bugging me. Okay. And we have an urgent challenge: the increasing frequency of zoonotic pathogen spillover and the threat of the next zoonotic disease pandemic that, if uncontrolled, could lead to another pandemic. Usually cases of like spillover, like zoonotic disease, starts small in a small community, individuals, and then it spreads to a larger community, goes to a different community, and then becomes an outbreak and then epidemic, and if it's not controlled, it can become a pandemic. It is estimated that over 60% of emerging infectious diseases are zoonotic, and within Asia, the potential for spillover is amplified because of the rapid environmental change, dense population, like I said just now, and intricate human-animal interaction. The Viral Genome Project estimated about a few hundred millions of undiscovered viruses with zoonotic potential. So that's a lot for us to worry about, and throughout the world, definitely, but especially in Asia, because we are really rich in biodiversity and we have multiple drivers that could potentially drive for more spillover to occur. So what is what is pathogen spillover, you might ask, if you don't know what that is. Not a lot of people like the word spillover because, you know, sometimes it's not like a natural word to say when you're talking about diseases occurrence. But this is a terminology that is being used, and it is an event where a pathogen transmits from one host species to another. It's the process of a pathogen moving from one reservoir host where it naturally resides to a recipient host, a new species. So it involves the crossing of species barrier. What's worrying is the zoonotic spillover. Pathogen spillover occur from one species to another animal species, and that is worrying, but it's more worrying, I guess, if you are really concerned about humanity, and we are human species, right? Should be concerned about humans. So we are worried about zoonotic spillover. So if you want to think about spillover in a more layman form, think of it as an event when a pathogen decides to network outside its usual circle, and where the unfortunate connection is a very dynamic ecological event wherein a pathogen successfully navigates the complex interface between animal and human hosts. It's a very sophisticated adaptive strategy by the pathogen. There are many factors that influences this, and it's called the recursive factor. So, for example, you know, the reservoir host has to be distributed in the right area, and there could be abundance of that, which can result in close interaction to human. And the pathogen has to be prevalent, of course, and there's opportunity for contact between the reservoir and the recipient host in an interface. So, interface is a system, is multiple systems that converge and coalesce, resulting in this ability for the pathogen to spread from one species to another. And of course, the recipient host has to be susceptible to the pathogen. When I said multiple factors just now, the ability of the pathogen to spread is driven by several factors. And drivers, if you're not familiar with that word, these are broad underlying forces that create the condition for zoonotic disease to emerge. And these occur at intersection. So intersections are specific points of contact and interaction where those drivers lead to actual pathogen transmission. So in Asia, we have a lot of these drivers. We're really rich in forests, right? Tropical forests, we host most of it, especially Southeast Asian countries. But unfortunately, because of multiple anthropocentric driven activities, we have lost a lot of our forests. Between 1990 and 2010, which is in the past 2 decades, we have lost about 30 million hectares of our forest cover, and that's the size of Malaysia. So that's pretty big. And this loss of habitat increases human-wildlife interaction, raising the risk of spillover. And as much as we are biodiverse, we are also rich with every living thing, including the pathogen itself, right? And the problem with lost forestation is the loss of biodiversity. And with lost biodiversity, you are interrupting the balance in the ecosystem, and you may lead to the predatory-prey imbalance, which may result in more vectors for pathogens that can spread to humans. And we are really we have a lot of traditional and cultural practices, and some of these cultural practices includes activities like eating wild animals. And we have a unique aspect of Asia is the availability of wildlife market. And unfortunately, some of the wildlife animals are traded illegally, and perhaps also some legally. So this presents a significant risk for pathogen spillover because it creates that complex intersection for ecological, economic, and public health concerns. So how do you prevent or how do you minimize pathogen spillover from occurring? How do you do that, right? When you look at all the drivers just now, these are really upstream factors. So how do you do upstream pathogen spillover prevention? So according to OLAP, this is One Health expert panel. Before this, it wasn't really acknowledged that upstream prevention is possible, but it is becoming something that people are speaking more about, that the people are now beginning thinking that it is possible. It's going to be challenging, but it's possible to do really upstream prevention. So to do that, then you're going to have these are actions to identify threats and to reduce risk of spillover. You're going to have to do risk reduction activities, understand infection dynamics in the natural host, addressing anthropogenic drivers of disease emergence, and you have to do integrated surveillance. And then you have the preparedness and response. These is the more downward stream kind of. So we're really like trying to really focus on upstream right now. How can we do this in a good way? And of course, I don't have the answer for you tonight, and it's going to be a 10-minute talk, and I have like 3 minutes maybe to really talk about this. So it's not going to be possible, but I'm just going to highlight what other people have said. So this paper is published in 2023. This author suggested the interventions to reduce risk for pathogen spillover and how to do that. So they, based on expert opinion, they say there's 5 categories of interventions that can be done. Number 1, stop clearing and degradation of tropical and subtropical forests. Number 2, improve health and economic security of communities living in emerging infectious disease hotspots. Number 3, enhance biosecurity in animal husbandry. And number 4, shut down and strictly regulate wildlife markets and trade. And finally, expand pathogen surveillance at interfaces between human, domestic, and wildlife. So sounds like something that you would definitely think about, like, hey, this is so logical, right? Those are the drivers, so we have to intervene at that step, there and then. But is this easy to do? Okay, let's look at that. Okay, stop clearing and degradation of tropical and subtropical forests. Great, right? If you have, we can do that. That's fantastic. But given the complexity, I'm not giving excuses, but I'm just saying that these are the things that we have to think about. There's economic drivers, competing land use, there's enforcement challenges, especially with low resource countries. We have to be thinking about that as well. And then improve health, economic security, of course, of communities living in emerging infectious disease. But we have to also tackle issues that is driven by poverty, cultural practices, lack of infrastructure, and political instability. Enhanced biosecurity in animal husbandry. We have to be thinking also about cost, global supply chain complexity, and farmer resistance. Shut down or strictly regulate wildlife trade and market. We have to be thinking about obstacles from economic dependence, cultural significance, enforcement difficulties, and global market. Expand pathogen surveillance. Yes, of course, this could be very resource intensive and requires extensive data sharing and ethical consideration. We have to take care of all that. We have to be thinking that if we're going into that level of intervention, it's not going to be an easy task, but we have to start somewhere. Another thing, because I'm a workforce capacity person, I love talking about workforce and doing training and capacity building. I always think about workforce and resource gaps in lower setting countries. Most Asian countries, veterinary, wildlife, and environmental professionals are low in terms of numbers, significantly so compared to human health sectors. So this hinder effective disease surveillance. You saw one of the major activities for upstream prevention is surveillance, right? So that's critical gap right there for early detection and response. And sectoral disparities and inequities pose a significant obstacle to effective spillover prevention. And in many places, including countries within Asia that's considered higher income or medium higher income, there's still underfunding of veterinary and public health workforces, which can create additional gaps in surveillance and response capacity. Also, there's financial inequalities and education training gaps that will further exacerbate these vulnerabilities. So I just want to show you Worah did this survey, and they found out that for most of Asia, only 7% of their members actually say that they have adequate overall workforce capacity. Most says that they do not. This is according to the PVS when they did their audit. So most countries did not score very well, and says that they don't have enough veterinary capacity. So Asia must prioritize equitable solutions that address these root causes. Things that I mentioned just now, some of the obstacles and barriers, these are root causes, right? This includes investing in local capacity building, ensuring credible financial resource allocation, and strengthening education and training programs that are culturally appropriate and accessible. Remember, we are really rich in our culture, so we have to respect that. So whatever that we do, we have to respect that aspect. Furthermore, sustainable and equitable agriculture and environmental practices are essential to mitigate the risks associated with habitat destruction and unsustainable resource use. I just wanted to show you a chapter that we did a while ago, the National Academy of Science. We did this chapter on countering spillover prevention in Southeast Asia. And I think a lot of this also speaks to true to Asia itself. There's a chapter that we wrote on how to enhance zoonotic disease management by addressing knowledge gaps and implementation barriers. So we listed down the barriers right here. I don't think I have time to go into this. I think I exceeded 10 minutes, right, China? Am I exceeding it?
Yes.
I've exceeded a while ago. You should have told me to stop. Okay, so I'm just gonna skip that. So if you're interested, I can share this book. It's actually available online. All the challenges and all the limitations that Southeast Asia faced, and some of the actionable steps and strategies that we can do to prevent that. Okay, in conclusion, is spillover prevention difficult? Absolutely. Spillover prevention is like maintaining the complex piping system in our only home, one that shelters everything we hold dear. Complex, completely, undeniably, but abandonment is not an option. We must maintain this home together, even though the inhabitants have very strong opinions about the decor, right? Our different cultures, everybody will have their own opinion. Inaction isn't an option. We simply cannot let our house crumble. What are the benefits of prevention? This is like an insurance, right? So paying dividends in life saved and societal stability, far exceeding the initial investment in a proactive health shield. What do we need? We need many things. But because I'm a workforce capacity person, I'm going to say that we need one health workforce revolution. This means strategically and equitably investing in training and deploying professionals across all sectors, human, animal, and environment, especially in spillover hotspots. Thank you, everybody.
Thank you, Prof. Latiffah. That was excellent. So, Prof. Latiffah spoke about the diverse cultures, languages, ethnicities, and practices in Asia, its rich biodiversity, anthropocentric activities that influence environment and pathogen spillover. She also highlighted the complexities when designing effective interventions from forest management, balancing health and economic security, animal husbandry, surveillance, ethical considerations, and even building the workforce capacities. And she also shared resources that we can look up following her talk. So thank you very much, Prof. Latiffah, for that very insightful, very concise talk in 10 minutes. And that was excellent. Thank you so much. Over to you.
Okay, thank you, Prof. So for our next speaker, we have Dr. Enkee. So Dr. Enkee Shiilegdamba is a Mongolian doctor of veterinary medicine from the School of Veterinary Medicine and Biotechnology of the State Agriculture University of Mongolia. She obtained a Master's of Preventive Veterinary Medicine and Epidemiology degree from the University of California in Davis, USA. And in 2004 to 2007, she has completed a postdoctoral researcher position at the Western Institute for Food Safety and Security at the University of California in Davis, USA. She is a wildlife and livestock disease expert, such as Pesticides petites ruminants, or PPR, outbreak on saiga antelopes, and wild ungulates in Western Mongolia, foot and mouth disease research in Mongolian gazelle, highly pathogenic avian influenza surveillance in wild migratory birds, and overall has transboundary animal disease and One Health experience. So we're very fortunate to have her today. Dr. Enkee, whenever you're ready.
Thank you very much. I'm also honored to be part of One Health Summit. Let me share my presentation. So my talk for today is importance of One Health surveillance in wildlife, because in many countries, One Health focuses on the public health, on the livestock health, but wildlife health tends to be like a gray area in many regions. And Mongolia is very different from Southeast Asia, where like East Asia more related to Central Asia. The species biodiversity abundance is also very different, where like very high mountain areas with large ungulate species. And we have a vast land with big territories of starting with Gobi Desert into high mountain areas. And we have important flyways for migratory birds. And we are sort of a hub for ungulates of Central Asia. And Mongolia is facing a lot of climate change impacts. And it's quite visible, and what's occurring is quite extreme. The temperatures are increasing, the droughts, desertification is clear, and we have extreme climate events. Starting in the summer, we get up to 40 degrees Celsius, down to minus 45 degrees Celsius, or up to minus 50 Celsius in the winter. So it's very extreme and fluctuating. And based on that, there is stress to the environment, to the people, to the animals. So there is a lot of intervention. And Mongolia has large population of livestock. We have all different small and large ruminant stock. And we have close to 75 million livestock. So there is a very strong animal disease, zoonotic disease transmission within the country. And there is a strong need to coordinate, collaborate on One Health, which not only focuses on the animal health and livestock health, but also need to consider wildlife. As I explained before, the Central Asia biodiversity is strongly connected with Mongolia. On the map, you can see the map of Mongolia with the populations of the Mongolian gazelle, the goitered gazelle, the saiga antelopes, the Siberian ibex, argali, the wild bighorn sheep. And this is connected to the Central Asian biodiversity populations. We have established One Health surveillance systems in wildlife, but it's not national long-term systems. It's mostly project-based systems. And whenever the project funding finishes, the surveillance system stops, which is very unfortunate. And as you explained, I was in charge, I was responding to the saiga peste petits ruminants outbreak that affected the saiga antelopes and other biodiversity in Mongolia. Basically, this was a small ruminant sheep and goat virus disease spread, transboundary disease spread in Mongolia, immediately spilled over into the wildlife. And in the beginning of the outbreak, we had over 10,000 population of endemic, critically endangered saiga antelopes in Mongolia. But at the end of the outbreak, we could barely count 3,000 or even less saiga remaining. And this was all because of the high interaction between livestock wildlife in Mongolia. And from this outbreak, however, we have experienced a lot of gaps and needs, and One Health approach that needs to be very strategically, systematically established in country. Basically, wildlife agency is not existing in Mongolia, and therefore reporting, documenting wildlife events is basically ignored. And we have stepped up and have done amazing work with the thanks of the Mongolian government, with the thanks of the NGOs, international organizations like FAO. And this pest aphids ruminants is not only impacting wildlife in Mongolia or in Central Asia, it's all over the world. It's a problem started in in the Africa, moving into Middle East, and through Middle East in Europe, arrived to Asia. However, this disease is mostly a ruminant disease, so I don't think there's a whole lot of disease spillover from wildlife into livestock. It's mostly, I think, livestock disease spillover into the wildlife. So Central Asia and Mongolia, our problem becomes not the wildlife origin disease spilling into human, into livestock population. We do have those diseases, the rabies, the highly pathogenic avian influenza, but because the animal population, livestock population is high and the biodiversity of wild ruminants is high, it's mostly the diseases transmissible between these ruminants is a concern for Mongolia. So based on our experience, we have established a multi-sectoral collaboration for wildlife disease surveillance at national and local levels, going down to local rangers, to livestock herders, government officials, provincial veterinary officials, private veterinarians, NGOs. And this was a really great collaboration approach that brought a lot of data, a lot of information, and we were able to document this tragic wildlife disease mortality and mass outbreak with scientific knowledge and information. We were able to train participatory epidemiology knowledge and techniques to implement wildlife disease surveillance to the communities, to the rangers, veterinarians, local government officials. We have been able to synthesize the knowledge that is within the local people, because local people are like the guardians of the biodiversity of the nature, are protectors of the human health, because it comes down to the animal health. And when the food is safe, the people are safe. So we were able to synthesize, bring in herders' knowledge, listen to their voices, and try to connect the gaps and needs with the national strategic surveillance approach and systems approach. There is also a special monitoring reporting tool implemented globally for the wildlife surveillance and monitoring. And there are multiple approaches within the smart system, like multiple applications. We only used one of the simplest applications to do routine monitoring by rangers. And through this approach, we have collected lots of data on wildlife livestock interface, on their where the source of the outbreak could be transmitted from livestock to wildlife. And then later on, the virus could be maintained within the, transmitted from wildlife to the livestock. So these approaches were very effective and collected a lot of information that were basically non-existing in country. And we have also recorded the movements of the livestock, the wildlife, pointed high risk areas for local officials where the national vaccination and disease monitoring targeting systems can be established. And this is a huge challenge for the government because we have 50 million small ruminants and unable to vaccinate every single animal to protect the human health, animal health, and the biodiversity. So we were working collaboratively with the government, actively pointing areas where high biodiversity and livestock transmission areas were highly likely this disease spillovers could be occurring and where we could protect the biodiversity. So my experience and work, although I'm a veterinarian, mostly within the biodiversity sector, within the environmental sector, and looking at diseases that are a threat to the biodiversity and how can we protect them, how can we establish systems, and how can we change national systems to protect the biodiversity, working within the One Health system, informing the public health, informing the livestock sector appropriately, and bringing on board. So I was also part of the World Bank One Health profile of Mongolia, and they have established a lot of One Health profiles within Southeast Asia. And I would recommend looking through this profile information. They have synthesized really great information on health risks, on One Health risks, where are the risks, and what are the threats, and how do we address these threats drivers, what needs to be done, what can be established at national level. So I know our time is short, and I try to summarize very briefly, although I cannot even go into highly pathogenic avian influenza. The wildlife surveillance monitoring is very costly, very expensive. It requires specific expertise, and it's not available in every country. So we're trying to modify methodologies that are environmental sampling methodologies, cost efficient, but able to also detect and identify the risk at source as early as possible. So for the avian influenza surveillance, we have been mostly targeting on the lake shores and fecal samples, dead bird sampling and testing, other than what we have been doing in the past, capture of live birds and sampling, telemetry installation. So all of that is very costly. So we're trying to simplify and look for best methodologies that can bring in local people, the experts, and the One Health approach that can be established in country. Thank you for your time. Thank you for your attention. And I'm happy to answer any questions in the next session.
Thank you so much, Dr. Enkee. It's a wonderful talk where we explored the landscapes and biodiversity of Central Asia and, of course, Mongolia. It highlighted zoonotic diseases in the region and discussed surveillance systems in place. And of course, a key case study was the PPR outbreaks in Saiga antelopes, shedding light on disease transmission and its impact on wildlife conservation. Truly multi-sectoral collaboration among all levels of the communities contribute to successful wildlife surveillance effort. Once again, thank you so much, Dr. Enkee. China, to introduce our next speaker.
Okay. Thank you very much, Dr. Enkee. Thank you, JP. So our next speaker is Dr. Sejal Worah, who has worked in the field of environmental conservation and sustainable development for over 30 years. And she's currently the program director at WWF India in New Delhi. And in this position, she manages and provides strategic directions to large interdisciplinary teams working on diverse issues ranging from landscape conservation to sustainable agriculture, river basin management to indigenous rights and One Health to business transformation. Her primary area of interest is the interface between sustainable development and nature conservation in light of India's rapidly developing economy and the challenges of climate change. And over the course of her career, Dr. Sejal has worked in more than 20 countries in South and Southeast Asia, the Pacific, and East Africa. She has been associated with a number of international and regional organizations and serves on various government committees and advisory boards in India and internationally. She's also the co founder and director of the first private nature reserves in the foothills of the Himalayas in India, which demonstrates the link between forest restoration, sustainable tourism, and local livelihood development. I'm very excited to hear her talk today. Let's welcome Dr. Sejal. Over to you, Doctor.
Great, thank you. Thanks, China, and wonderful to be here. It's always embarrassing to hear these long introductions. So thanks for doing that. And what I'll do is jump straight in to my talk because the time is really limited. I've taken a slightly different approach. Let me share my screen to start with. Can you see this?
Yes, perfect.
Okay, great. So what I'm going to do is very quickly take you, and this was actually recommended to me by the organizers, is to take you through a few examples of how we are addressing the interface in communities, natural resource management as one of the drivers of One Health, and climate and all the other factors that have already been talked about. So let me just start on this journey. And I've taken 5 examples. China and me, if you think over time, I can always stop and drop 1 or 2 of the examples if it looks like we're going well over time. All right, so let me start by introducing, so WWF, most of you know, is a conservation organization. And as a conservation organization, we've always known that forests are critical to conserve, and for a variety of reasons. And you all know this, so I'll run through this very quickly. Forests are important for all of these different reasons. But increasingly, we're also recognizing that forests are important for health in the context of a One Health approach and in the context of pandemics. So this is something that WWF as an organization has fairly recently embraced as one of the additional pillars that we are working on. And this is the kind of framework that we as an organization are looking at in terms of One Health.
Sorry, Dr. Sejal,
This is
are you
very
moving
similar.
your slides?
Yeah.
Are you moving your slides?
Sorry?
We are only seeing
Yes,
the
are
first.
they not moving?
Yeah, maybe you can reshare it
Oh,
again.
okay.
It's moving
Okay, let
now.
me
to
try
the...
again. Sorry about that. Is it moving? Can you see? 1 second, let me just pull it up. Can you see the second slide? Is this
Yes,
visible?
now
Or
we
you
see
still
the food disaster
can?
livelihood.
Okay, okay. So this was the slide that I just talked to, which was about the importance of forests and the role of forests in health. This slide, and can you see the third slide now?
Yes.
Is it visible, the third slide? Yes,
Yes,
okay.
it's
So this is the framework that this is the framework that WWF is using for the One approach, and it's very similar to what Latiffah shared, and I think is similar to what is seen in much of the literature. It's just a different way of framing it. Maybe the language is slightly different, but in the end, it's really looking at the same 5 pathways that have been talked about, which is landscape immunity, which is about basically protecting landscapes and ecosystems, preventive medicine, which is heard about, sustainable livestock management, which again came out from the Mongolia example, wildlife trade, which has been mentioned as a very important pillar, early warning systems, and of course, behavior change, because without that, nothing else is possible. So this is the framework within which we work on One Health. What I'm going to focus on today is really these 2 aspects of it. One is the landscape immunity, and the other is the sustainable livestock management. These are areas where I will share some examples of actual interventions and actions on the ground that can be done to address these 2 very issues in the One Health framework. So key approaches that we look at under this, one is, of course, again mentioned before, is arresting fragmentation and degradation. As we all know, fragmentation is a major driver, bringing increasing proximity of livestock and wildlife and increasing chances of spillover. Human-wildlife conflict, again, comes up as a major issue because it is the interface between livestock, humans, and wildlife. Forest and rangeland management, this is the role of communities. And one of the things we work very closely is engaging and empowering communities in forest and rangeland management. Freshwater ecosystems, underrated, neglected, but very, very critical in terms of overall ecosystem health. This is, again, something we work on quite a lot. And climate change. Increasingly, the links between climate and health are becoming apparent. So also looking at how do you reduce climate vulnerability and therefore also reduce vulnerability to diseases and pandemics. So these are the approaches, just some of the approaches we use, some of the things that I will talk about in the example today. So let me start, first of all, with the human-wildlife interest. So I just mentioned examples are from India, from very different parts of the country. As you know, it's an incredibly diverse country, and we cover everything from forests to coastal systems to mountain systems. So I will take you through some of those systems. This is a typical photograph of a rural community in India. And you see that it's completely interspersed and integrated between forests, agriculture, livestock to some extent, and people. So you can see that the interface areas are very, very high. Livestock, India has the largest livestock population in the world. A large amount of this livestock actually grazes within forest areas and within areas where wildlife is also pretty prevalent. So obviously, again, the chance of interaction is very, very high. So one of the things that we've been working on is looking at this interface and reducing conflict between wildlife and livestock. You see here a photograph, and this is very common across many reserves in India, is a cow being fed on by a female tigress and her 2 cubs. This is the impact on people. They lose their livestock and then come in close contact with the livestock that's been killed by wildlife. What we've been doing for the last decade or more is basically created a system where we immediately provide relief, financial relief to the communities whose livestock has been killed by wildlife to ensure that A, the interaction is minimized, and B, there's no retaliatory killing of the wildlife. This system has worked incredibly well over the decade. We've seen that in areas where we do this, there's been almost no retaliatory killing. And governments have stepped in many cases to take over the system to improve it, which is the ultimate aim that we have. What we've increasingly also started doing is to look at longer term solutions like livestock insurance. And here you see a community where we've been propagating livestock insurance, which actually encourages communities to manage their livestock more responsibly. I won't go into details of the scheme because we don't have time for that. But just to say that the whole idea is to move on and create incentives for improved livestock management so that the interface is reduced. I'll just take you on another example to a very different part of India. The one that you saw earlier was from the Tarai landscape, which is in the plains on the border of India and Nepal. This is up in the high Himalayas in Ladakh, which is on the border of China, actually. And here again, livestock and pastoralism is, of course, the main way of life, very similar to Mongolia. Landscape also is quite similar to what we just saw. Large amounts of sheep and goats and yak, which are reared by local communities. Of course, the problem here is this creature, not so much the tiger, but the snow leopard, which creates a problem for livestock herders. And of course, the problem with snow leopards is that when they kill livestock, they don't kill just one. They can actually destroy an entire flock. And here you see a leopard that has actually killed the entire flock of this couple. And they get into these very badly made corrals that the community uses and tend to kill all the sheep inside. What we have been doing here with the communities is actually creating what we call predator-proof corrals, a very simple design, but which actually diminishes the interaction between livestock and wildlife to some extent, so that the livestock are managed. This is something that has taken up a lot of speed, and across the landscape, we're finding that and the government has stepped in to help improve basically livestock management, which will help overall in the reduction of the interface. I'll just quickly move on to another part of the country, which is in the northeast. This is on the border of India and Myanmar, in a place called Arunachal Pradesh. And what's very interesting about this area is that most of the forests here are owned by the communities. So what you see here is a village, the agriculture field of the village, and all the surrounding area you see is the forest that actually belongs to the community. What's been happening lately is that these forests are getting more and more degraded and destroyed as a result of external demands on timber, on logs, on firewood, on various land use changes. So we've been actually working with the communities here to encourage the communities to protect their own areas so that they don't fragment it. And the typical village with very diverse agriculture, again, this is very fast, and we just want to make sure that as lifestyle changes happen, we don't actually lose and fragment these intact forests. This is a community, it's a Monpa community, they're mostly Buddhist, and therefore have a very strong connection to the land and very strong connection to the forests as well. So we, the community and a number of talk about the idea of setting conservation areas within the forests. The community bought into the idea and set up its own management committee. So this is the management committee of one of these community conserved areas. This is their signboard. What's very interesting is that the community now has developed their own management plan for this area. And we're also working with them on a number of livelihood initiatives, looking at community-based tourism, looking at adding value to some of the non-forest products that they are using from the forest, looking at agriculture systems, reviving traditional agriculture, all kinds of things. I won't go into that. But the important thing here is that this is a model that we started with a 300 square kilometer forest in one community. We are now up to 10 community forests and almost 1,000 square kilometers that has been protected directly by the community. So again, a very important initiative to look at community-based forest management to prevent further degradation and fragmentation of the forests. Very quickly, I'll take you to another part of the country, which is the Sundarbans. This is the world's largest mangrove forest. It actually straddles both India and Bangladesh. And it's also the only mangrove forest in the world which actually has tigers in it. It also has one of the highest incidents of human-tiger conflict in the world, and this is one of the issues that we work on. But the main issue that we are working on here is around climate change and sea level rise, because this is one of the areas where you're starting to see real impacts of climate, and you're starting to see climate-induced migration as well. So this it's a complex system of mangroves. The main form of transportation is by boat. There's very few roads in the area, and people are extremely vulnerable to sea level rise. This is a daily struggle. As you can see, they're trying to prevent the incursion of seawater into their fields. So you see a paddy field on the right and seawater incursion on the left, and people struggling to build embankments to keep the seawater out. Obviously, salinity and salinity ingress is a very serious problem here. What the government does is build these big embankments to protect people and to reduce vulnerability to sea level rise and climate incidents, cyclones, hurricanes, all of the like. The problem with this is that it is very cost intensive and it gets destroyed year on year. So every year you have to rebuild these embankments, which are something that is not feasible to do everywhere, leaving people exposed and vulnerable. What we've been experimenting with, and this is a classic case of a nature-based solution, which is looking at traditional knowledge and using traditional materials to try and create natural defenses rather than creating artificial defenses. These are simple terracotta rings. Terracotta is a kind of a mud which these people have been, communities here have been using for generations for various kinds of buildings and artifacts. These terracotta rings are placed in this kind of a zone which is between the shoreline and the ocean. And they act as silt traps. So what they do is they trap the silt, and within the trapped silt, the mangrove seedlings get trapped. And what you have is a living wall that starts getting created in the shoreline. And you start seeing this. This is only a year old. And you've already got a living shoreline. We are calling this the living shoreline approach, which is encompassing the islands. And it's a very simple, very low cost, very traditional based solution, which is long term, because these seawalls will not get washed away every year once they get developed. So again, a nature based solution addressing both climate change and people's vulnerabilities in a way that probably and hopefully is replicable. Again, something that we're pushing for a policy change on so that we can get this replicated in across the islands. And my final example is around, as I said, freshwater and rivers. Very, very important system. One of the problems in India and the rest of the world is the use of rivers for irrigation is actually destroying the rivers. There's over extraction of both groundwater and surface water, which is leading to rivers drying up, dying, and leaving people and agriculture vulnerable. So we've been working with farmers in northern India. This is a sugarcane area, and you can see that the sugarcane field is completely flooded. It doesn't need to be flooded, but for various reasons, farmers prefer to flood these fields, as a result of which the rivers and streams in those areas are completely drying up. This river has not seen flowing water for about 20 years or 30 years because of over abstraction for inefficient irrigation upstream, which means that downstream farmers get no water. So we worked with the farmers here and had a long discussion with them about how do we actually save water by more efficient practices. And if we save water, importantly, can we release this water back into the river and bring the rivers back to life? So it's about reviving and restoring water sources. And surprisingly enough, the farmers agreed. And they said, yeah, if we can save water, we will not use that water for more irrigation or for more crops, but we will release that water into the river so that downstream farmers can also get water and the river gets revived. Again, cutting a long story short, we looked at different farming practices, we looked at water saving, we looked at reducing chemical input. All of that added up to better agriculture for the farmers. We also looked at revival of the canal system, which had been completely deteriorated. And as a result, and this is a nondescript picture, both of these pictures are kind of nondescript. You'll wonder what they are. But for me, they're extremely exciting because for the first time, we saw that water was saved and released back into the river. Both of these photographs are showing irrigation water saved by the farmers, 30%, and it's actually going back into the original river, something that I thought would not be possible. This is what the river looks like now. And I just want to end here with the final picture, which shows that first time in 30 years, the kids of this village are actually seeing a flowing river. And it was a wonderful example. So that was my very quick journey to take you through some live examples of how you can address, health issues, climate issues, community empowerment, and also natural resource management, which all is for a One Health approach. Thank you very much. Sorry if I took more time.
No, that was an amazing presentation, Dr. Sejal. Wow. I mean, just looking at all the successful interventions that you have showed us and just really opening our minds to what is possible when we're working very closely with the communities and really understanding the natural resources in that area and really using the full capacity of what nature has to offer and also addressing the conflicts between wildlife and human and addressing climate-induced challenges. So it was really rich. I'm just in awe, really, looking at all the pictures as well. So thank you very much, Dr. Sajal. That was a very, very rich presentation.
Thank you. So we can now move on to our next speaker, Dr. Mark Kevin Badiola from the Local Government Unit of Iriga in the province of Camarines Sur, Bicol, Philippines. He is a licensed veterinarian with 9 years of experience, graduating from the Central Bicol State of Agriculture in Camarines Sur, Bicol, Philippines. He currently serves as a government veterinarian, working closely with the community, policymakers, and even academia. And his professional background spans companion animal medicine, corporate setting, and nearly 5 years in government service. Dr. Badiola is also the co-owner of 2 veterinary clinics. So, Dr. Badjo, whenever you're ready, and yeah, welcome.
Thank you, Dr. JP. Good day to everyone. Is my audio clear?
Yes, Dr. Badiola.
Let me just share you my presentation. Can you now see my slides?
Yes, Doc, but there's a gray part on top. It's a small gray box on top, Dr. Badiola. But I think it's the Zoom interface. You could just, yeah, perfect.
Okay. So my topic is basically understanding the importance of the local government unit veterinarians or government veterinarians to local animal industry and public health. So basically what I'm going to share with you are the mandated functions of LGU vets or the programs that directly affects the local animal industry and public health. So first are the livestock services. Under the livestock services, we do the animal health management. Local government veterinarians play a crucial role in managing animal health through routine checks and interventions. Uh, here in Philippines, one of the tropical country, we usually encounter problems uh, like parasitism and diseases that are associated to constant changes in weather conditions. So services like deworming, routine deworming, vitamin supplementation, vaccination, and treatment are so beneficial to especially to the backyard livestock raisers. Next is the disease surveillance. LGU vets conduct disease surveillance to identify potential threats in animal populations. This proactive approach allows timely responses to disease outbreaks that could impact human communities. Right now, our major concern is the African swine fever that continues to devastate national hog industry. We also are looking at the NCDs, hemorrhagic septicemia, that are also very common, especially in our region, and also the tuberculosis. And also, we are being directed by by the national agency to look for, to conduct disease surveillance on avian influenza and brucellosis. Part of also of our function is to conduct emergency response whenever there's a report of multiple deaths or farmers that needs our services. We deploy a team for us in order to conduct a disease investigation and to ensure the effective management and mitigation of the potential health risks. LGU vets are also assigned to conduct and maintain animal checkpoints, quarantine, and farm monitoring. These were very critical, especially when there is a risk of transboundary diseases, especially African swine fever. Local veterinarians implements border checkpoints and monitoring of imported animals, stockyards, trading posts, and commercial farms. This method plays a crucial role in preventing entry of transboundary diseases, especially to livestock, and potential public health risks. Our team is also be involved in genetic improvement. So LGU Vets continues to conduct genetic upgrade for local livestock to increase the farm yields and income. So normally our livestock are native, and we wanted to improve their genetic so that we could arrive for a better production yield to the farmers. So what we do is we continuously conduct field-based estrus synchronization and artificial insemination for large ruminants and swine. So, and also whenever available, our we have a budget for this. We also do animal and feed dispersal to backyard racers. Our team is also involved in training livestock programs and livelihood programs. Workshops conducted by our office provides hands-on training and communities on recognizing signs of zoonotic diseases in animals and improve livestock raising practices. Training sessions are designed to empower citizens with skills and knowledge to take proactive measures. So right now we have a graduating class of Farmer Livestock School on Goat Management Enterprise. It took us 22 weeks training, and after that, after the training, we have a re-entry plan, and so that in a few months from now, we will be evaluating if their husbandry practice and or also their farm has improved. Next is our office is also involved in companion animal services, first of which is the comprehensive rabies control programs. We do the mass vaccination program and it's essential in controlling infectious diseases, especially rabies. These efforts protect both animal populations and public health from zoonotic diseases. So what we do is we do the house-to-house anti-rabies vaccination and animal registration. While we supposedly we do not encourage this system, the house-to-house system, but what we want to achieve is the herd immunity. We wanted to vaccinate as many as we can, so what we do is we go to their houses in order for us to vaccinate more. So there's a higher compliance. Our team is also proactive in conducting dog and cat population control through mass spay and neuter activity to minimize the proliferation of stray animals and prevent unwanted pregnancies on animals that often lead to abandonment and other related problems. Stray animal impounding based on the local ordinance. We are involved in catching stray animals and setting quarantine protocols. These measures are also vital in managing outbreaks and minimizing disease transmission to humans. So also stray animals are responsible for multiple vehicular accidents in our locality. So this is imperative for us to conduct not just accident related, but also on the garbage littering, which is also can cause or contribute to more disease transmission. Our team is involved in disease surveillance, diagnostic, and treatment for small animals. Local veterinarians collaborates with public health authorities to share data and coordinate efforts in outbreak response. So strong collaboration with our human medical counterpart to ensure zero deaths on incident involving animal bites or animal disease. When it comes to this aspect, we are closely collaborating with our human counterpart and also on the regional animal disease diagnostic laboratory. So what we wanted is whenever there's a suspected rabies case, we immediately deploy a team for us to conduct an investigation. We get the sample, we test it, and we also send it to the laboratory for gold standard confirmation, and so that we have a quick disposition whether we have to go back to the community where the ground zero and conduct ring vaccination, conduct an awareness campaign, and revaccination to all animals that were already vaccinated. So that's what we do. And for our human counterpart, we have a system that has a database of all vaccinated dogs in order when the animal is not vaccinated, the owner of the animal is responsible for every cost that is that should be shouldered for the animal bite victim. Our office is also involved in slaughterhouse operation. We do the butchering and meat inspection. LGU-led slaughterhouse operation ensures a safe and quality meat for public consumption through its standard ante, mortem, and post-mortem inspection procedures. We effectively minimize potential public health risks by condemning animals manifesting signs of illness and carcasses with apparent lesions suggestive of disease. So sometimes animals that are brought to slaughterhouse doesn't exhibit a signs of disease externally, but with our cooperation, with our office cooperation to the slaughterhouse operations, we get to eliminate animals that are suggestive of having a disease through post-mortem inspection. So food safety and regulatory compliance is also, our office is also involved in post-abattoir inspection and enforcement to ensure the public compliance to health regulations. They enforce compliances that promote sanitary standards and ethical meat trading. So all meat stalls should be registered to our office, and also those meat that do not pass or are not slaughtered in the accredited slaughterhouse should be embargoed and should be condemned. Our office is also involved in public health awareness programs. First, the educational campaigns. We do the awareness campaign and also the pet owners parade and activities. Community engagement, our effective community engagement is essential for raising awareness of zoonotic diseases. Local veterinarians are catalysts in promoting community development. This involves collaboration between veterinarians, livestock organization, and community leaders to host local events that encourage dialogue about health risks and preventives. Involvement in creation of regulatory policies and programs. So as a veterinarian, as a local veterinarians, all our programs should be backed up by a legal basis. So it is important that our office has a strong collaboration with our local policymakers in order to have a comprehensive local policies for implementation. And partnership with NGOs and community leaders, this is very important. Of course, without them, our programs, especially for community development and livestock industry, will not be effective. So facts of the matter, local veterinarians are responsible to a wide range of services for local industry and public health. So we are not an expert of, basically we're not an expert of one aspect of livestock of the animal industry, but our intention is to serve every livestock or any individual that needs our services. This is for Bicol region. Out of 113 local government units, only 27 has their local veterinarians. LGUs with veterinarians reports higher zoonotic disease incidence. So this is not surprising, but this should be taken very seriously because our local leaders, our national agencies base their policies, their investment, their programs on the data that they have been received. So whenever the data is, whatever the available data, that will be their basis. So it is important for every LGUs to have their veterinarians in order to come up with a better and more complete data gathering. So our local chief executive or our bosses and legislators are subjected to election every 3 years. So continuity and sustainability of every programs that will affect the public health and also our functions as veterinarians will also vary. And in Bicol region, we experience an average of 15 to 20 typhoons every year. So this is a very serious challenges for us because this has an implication in our long-term programs, especially to livestock. Imagine if you have 15 every month you experience 1 to 2 typhoon. This makes our programs very hard, especially in sustaining the inventory of our local livestock industry. So that will be all, and thank you.
Thank you so much, Dr. Kevin Badiola. It's very inspiring. It's always inspiring to hear from people on the ground working with the community itself, integrated to the community. And it's like we could definitely see how challenging sometimes it could be to be a local veterinarian in our country in particular with all the things that you have to do, from public health to research to policy implementation to training, and even to with communicating with policymakers and spreading awareness. But ultimately, we can see that the care and passion is there for our community in general. So once again, Dr. Bajola, thank you very much. And yeah, so for now,
Great.
yeah, I'll ask you, Doctor, to stop sharing your screen. Again, for our participants, please feel free to type in your questions in the Q&A box. Don't hesitate to introduce yourself, where you're from, and your affiliation. And also, please mention where your question is addressed, to whom your question is addressed to. So here, just quickly before we move on to our panel session, and as you type in your questions, we will be pasting a Mentimeter in the chat box. Um, do you have it? Mm, yeah. Or you could go to menti.com and was I muted? Okay, I'm so sorry. There.
Okay, so we're getting a lot of responses now. And I can see that most of it is surrounding the themes of resources, budget, as well as human behavior, self-interest, egos, fear, tunnel vision. So a lot of human-centric values that we need to encounter when implementing One Health. Okay. So let's move on to the next session, which is our panel discussion. So feel free to leave the questions in the chat.
And we'd also like to invite our panel speakers to open camera and prepare for the panel discussion. We already have one question in the chat, so I believe this is addressed to everyone. Especially I think to Dr. Bajola, since this question's on veterinarians. It says here, yeah, are veterinarians able to convey their findings and be heard by public health governing bodies? So if they observe something unusual, can preventive measures happen proactively? Or do situations or silos of industry, etc., hamper this? Yeah. So for example, if they observe something, can they just implement their response? Doc Kevin, in your experience?
Okay, thank you for the question. Uh, Based on our experience, it depends on whether the protocols for the specific disease prevention are available. Usually in our structure, the protocols for disease investigation up to the indemnification are downloaded from the national agency, and it is just for us LGU veterinarians to adopt. So if it's available, then we can follow it step by step. But if it's not yet available, we have to first report the problem, the case to our higher office, which is from our side, the regional office, and ask them for their advice. It all should be based on it all should be aligned to our higher offices before we do. But we can do the disease investigation, but as to whether it should be condemned or it should be or any protocol that for control protocols all should be aligned to our regional offices. Thank you.
Thank you, Doc Mark. Prof. Latiffah, you unmuted. You wanna say?
Yeah, I just want to add on to what Mark said just now. I think for the most part, if you're a vet in a country, um, uh, he's absolutely right. It depends on the disease, but if it's a disease of human interest as well, for example, if we're talking about zoonotic diseases, most countries now have their strategic action plan for One Health, and most countries actually have committees or intersectoral committees that actually address these concerns, and they have definitely a protocol, standard operating procedure by which this type of observations can be directly reported to the right authority, and from that authority, whether it should be shared to other ministries for action that is depending on the situation. For example, if it's avian influenza, definitely there will be a rapid communication and sharing of information to the to multiple agencies so that they can do the response at the same time. So it's mainly coordinated response, and the communication also occur using a very specific flow of action. Thank you.
Thank you, Prof. Latiffah. So we also prepared some questions from the moderators, and one of it is so Dr. Sejal and Dr. Enkee, you showed many wonderful examples of working with the communities and implementing successful interventions. So what advice would you give future practitioners? And I have a follow-up questions for that. And what are the values and principles do you think are important for us to embody when engaging with communities? Dr. Enkee?
Thank you. So most of the zoonotic diseases, One Health concerns come down to the source. So can we address, early report, early detect the disease? Whether it's an animal origin disease, whether it's a wildlife origin disease, we have to prepare the local communities, especially the in Central Asia, we call herders, the pastoralists who are tending the livestock, the rangers who are monitoring the wildlife, and the local residents who are living among this biodiversity, among these communities. So there's a lot of, when it comes to Mongolia, we have large populations of biodiversity, above 1 million Mongolian gazelle. So people do not pay attention when an animal dies here and there. They just think, oh, this is an annual disease, annual die-off. But if they start observing more than usual, they have to know what to do, where to contact, how to report. And all of that information is unfortunately not at the local community level. So for us conservationists, the best guardians of the environment is the local community, and we do work very closely, engage the communities, inform the communities, and also pull out a lot of information from our communities. That is also affecting the national strategies, policies, procedures, because usually we have top to bottom policies, but bottom to top information flowing mechanism is really lacking. So through our community engagement committee, participatory approaches, we try to bring in local voices into the national policies. So yeah, it is very important, and there's a lot need to be done. Yeah, thank you.
Dr. Sejal, would you like to
Thanks.
add?
Yeah, I'll let me just turn my video on. Sorry, I'm keeping my video off because my connection isn't great. But can you hear me?
Yes.
Yeah.
Your background is
So,
amazing.
what's so interesting from what you just said from Mongolia is we have exactly the opposite problem. So you have very few people, a lot of land, and a lot of wildlife in the millions. We have people in the billions, land which is very, very, it's converted. A lot of the land is already converted, but we still do have reasonable wildlife populations in India, certainly more than in many other parts of Asia. So the challenge that we have is with so many people and quite a lot of wildlife is how do you manage the interface? And it's not just about conflict. So managing conflict is one side of it. But one of the things that we are looking increasingly at is what does coexistence with wildlife and nature mean, on a planet that's going to get more and more crowded? So overall, the problems that we are facing in India are going to be common to many other countries in the world as we develop, as human populations grow, as land use changes. So, this is I think if we can crack this problem, or if we can address some of these problems in India, then we can address them anywhere else in Asia. So in a way, a lot of the approaches that we are using, it would be great to see if they're transferable, if there's something that can be learned from that. I was very fascinated by the presentation by Dr. Badiola, on how systematically the veterinary system is trying to gear up for the future challenges. And I'd love to take that presentation back to my team and show it to them. But anyway, that's talking about exchanges. On the community level, I think, as I said, we want to focus on this concept of coexistence and manage that interface. We do not see a future in many Asian countries where you will completely separate livestock and wildlife. It's just not possible. There's always going to be the interface between livestock and wildlife. The question is, how can we work with communities to manage this interface better? Some of these issues related to zoonotics and pandemics are completely new to communities. They have a lot of indigenous and local knowledge on many aspects of managing their livestock. But basically, this is something new. So I think awareness raising, bringing communities into the picture, making them part of the solution is the most important thing. If it is a completely top-down approach, you will only find it going so far. And we've learned this from engaging communities on other issues, including natural resource management. I think we can use a similar approach for engaging communities in addressing issues of One Health. So I think, again, learn from what we've done in the past in working with local communities, bring this aspect in, and awareness raising is going to be the first thing, right at the beginning. And that's right now our biggest challenge in promoting One Health is just getting both the communities and the government officials to address the seriousness of the problem, because it's long term, it's not seen as serious. And usually people want to address short-term immediate problems rather than something that's in the future. So I think that is a challenge that we'll need to overcome as well. Thank you.
Thank you, Dr. Sejal. I think Marie, Rachel raised. Oh, Prof. Latiffah.
Yeah, just are we allowed to ask another panel? Can a panel ask a
Why
panel?
not? Of course. Yeah, that's
I would like to ask Sejal just now. Sejal, how do you incentivize the community to work together, to be empowered to tackle their own problem? How do you incentivize that? It's hard work.
Yeah, I mean that's a $1 million question, and the incentives will be very different in different places. You cannot assume that the same type of incentives will work for all communities. So one of the misconceptions, or let's not say misconceptions, one of the things that we worked around a lot is that economic incentives are very important. Right? That so if there is a financial or an economic gain to be had from a certain type of behavior, then communities will adopt that behavior. Which is true to a large extent. So just like you and me, communities are also driven by economic concerns and livelihood concerns. So obviously livelihoods is one of the big incentives. But we underestimate communities when we say that it's only economics that drives them. And we found that there are so many other factors that can act as an incentive. I mean, even a simple thing like pride. Community pride, community cohesiveness, capacity building, skill development. These are all areas that can act as incentives for communities, and usually it's a combination of multiple things. I would not recommend that we only look at economic incentives when we work with communities, but we also look at what motivates the community. And then work on those motivations. And what we don't do enough, especially also us as a conservation organization, we don't look at the social parameters enough. So it's only recently that we started looking at, what motivates communities, what drives them, what are the perceptions of communities. So some of these softer areas, some of these less tangible areas, if we understand them better, we'll be able to engage much, much better with communities. So I think it's looking at different things in different places.
Thank you, Dr. Sejal and Prof. So we have an influx of questions here. I think Marie, Rachel, you raised your hand earlier.
Yes, thank you so much for the recognition. I hope my audio is okay. So, hello everyone. I am Dr. Rachel Jean Mangading from Central Bicol State University of Agriculture, College of Veterinary Medicine, and I'm really grateful for being part of this event, third annual EcoHealth Global Summit 2025. I actually have several students with me here at the Zoom, and we're just really grateful for the knowledge and for the insights that you have shared with us this morning. For my question, what do you think you can share to young One Health advocates to help the different advocacies presented in this summit? And another question for me, from the academe that do a lot of research and extension activities with limited fundings, how do you navigate challenges in low resource settings when managing these issues? So I think I address the question to all finalists, please? Thank you.
Oh,
Who wants to go
yeah.
first? I guess I'll go first because I'm with the university. So Marie, I completely understand where you're coming from at the university. I think all over the world we're having the same issue. Do more work for less, right? Produce more for less, right? We're expected to produce a lot of papers, but no research money, right? So this is the same situation everywhere. I think it's becoming to be true also in the United States, given what's happening with the way that science is being handled here and with the grants and all. But in our part of the world, this has been consistently the case. So I would imagine that one of the ways by which you can do research is to work collaboratively with those people who actually have information and data and who collected them routinely, because it's their job to do that. And I'm talking about agencies in the government, like if you're with the Ministry of Health, You can work with the Ministry of Health. If you're bad or in agriculture, you can work with them. And these the agencies actually routinely collect some type of information and data, and they may not necessarily have the time nor the capacity to analyze this information, to make sense of that information into something that is usable. They may have like the capacity to do some superficial type of analysis, but not in depth, not looking at trends over the years, at least not in our part of the world. So you can offer your help for free. It's like free labor. But at the same time, of course, you have to be smart about like making sure that it's something that you can publish alongside the collaborators at the ministries or at whichever agencies that you're working with. And you can also work with NGOs. I think the Philippines probably have many NGOs who has been working with the communities or working with the sectors or working with, I don't know, whoever, and they usually have a lot of information and they collect data. And you can work with them, offer your services, because I'm sure you have a lot of skills and competencies that perhaps those agencies do not have, and you have. I won't say you have the time. I don't think any of us have time, right? But it's like we make time. Let's make time to do research, because these are the things that will answer the questions that's very important to your country and to your community. These are the problem-solving type of questions, because in our part of the world, we don't do research necessarily because of scholarly endeavors. It's mainly to tackle very specific problem, immediate problem. Our research are very operational and functional. So it's servicing something, right? So you're helping your country that way, providing the information that could be used for policy making, for decision making, and for further use for research or for any other kind of like ventures. Also, and for the students who are interested in One Health, I think China could answer that question, because China was my previous student. She's my protege, basically. She's also my PhD student. She was my DVM student. So maybe, China, you want to answer that question?
Oh no, I'm put in the spot right now. I think with the students, I think it really starts with really exposing them and showing the wide varieties and ways that they can contribute, and also let them know that uh like change is possible, and the beauty of collaboration and communicating across different fields is really good, and just be active in the activities that my Ohun have, and the CO Hun has for us. Unfortunately, the funding now is a bit uncertain, but we hope that there will be more of this groundroot efforts as well from the universities and all, and for the students, and just really supporting us. I think I had a very good support throughout my vet school years, and I think that's most important for the students. Yeah. Thank you. So, we sorry, I was just put on the spot. I wasn't prepared to answer that question. And because we don't have much time, thank you so much for the questions that are coming in. We will just ask one last questions to all the panelists, and this question is from someone who says that if they are not from vet science or any formal institutions, how can they best contribute to this kind of interconnected and future that we are envisioning in this Earth Hub? And we open this to all panels. And Dr. Enkee, Sejal.
Thank you. I think everyone has a role in One Health. It's not just the health professionals. Like I said, when we are working at the source, everyone has a responsibility. And even if students who are interested in, obtaining more information, more knowledge, more expertise, there's a lot of experience and opportunities in the field, because a lot of information comes down from the field. Having students interested or people, general experts interested to collaborate, coordinate within the One Health sector, there's a lot of room. I mean, it's not only for health experts because it's working, disseminating the knowledge, information. So it is like anyone who can put together a brief brochures, informations together and inform the local people, the communities, the local professionals. There's, I think, room for everyone. And in all of the countries, One Health is fairly new. We don't have experts within this field. And we're just trying to establish our One Health joint plan of action for the countries, the system for the countries, and how it translates the national systems into local communities and local regional level. So there is a lot of room. Whoever is interested in One Health and think they see their opportunities, they see their value. I think it's important to reach out your local experts, whether it's veterinary or human health, public health, discuss with them how you can contribute. Because a lot of us experts don't have knowledge on like designing, putting together information pamphlets, those like reaching out to communities and talking to them requires some specific skills, and scientists and experts, we are limited within those skills. So students, young professionals are very eager, very talented, knowledge in these new ways of social systems interactions can contribute to the scientists and support the One Health. Thank you.
Thanks. Maybe China, I'll just jump in because I have to drop off soon. I'll address both the questions. I think what was articulated just now was absolutely spot on. There's room for everyone. There's so many different areas and so many different skills required in moving the One Health agenda forward, that it doesn't matter what background you come with and what skills you come with. In some way or the other, these will be useful. And this is, actually manifested very much in my own organization, because most of the people working on the One Health Task Force, for example, in WWF, are not necessarily doctors, epidemiologists, veterinarians. They're actually, conservation scientists, biologists, communicators, people who are just interested in the topic and want to learn and want to contribute. So I think there's no limit, because there's so much needed, right, from communication to the technical skills, to the medical skills. So it really is up to you and the people you interact with to figure out how you can best contribute. It's an open slate, actually, as of now. We're all learning as we go along. The other thing I just wanted to mention was also the question about the researchers and the universities. And again, going back to what Dr. Latiffah said, there is so much data out there. I mean, it's the same with us. We collect so much data from the ground, which we don't analyze, which we don't use, which is lying there, and it bothers me to no end that there is this incredible amount of data in the right hands. It could be turned around into something very useful. So I think, and so what we are looking at now is a much better collaboration with universities. Universities are hungry for data. We are sitting on unused data. So it's actually a perfect combination to bring the two together, where field-based organizations and conservation organizations who work on the ground can share their data with universities and academics to come up with something amazing. So we don't even need to rely on government data. We actually are sitting on this. We just need to be more systematic and have better collaboration, which I think will make it work. Thanks. Over.
Okay. Speakers, Dr. Badiola, do you want to say something? Feel like
Okay. So maybe I want to share something from a local veterinarian's perspective. So how can everyone contribute to One Health? As I said a while ago, our office depends, the program or implementation of our office depends if there's a localized or adopted legal basis. So sometimes our legislators, our local leaders do policies or invest in something depends on the clamor of the public, or whether they are influenced by the public's demand. So, my message to everyone, especially to students or anyone that is not directly uh, uh, involved in veterinary offices. So maybe let their ideas, let their advocacies be heard. Make it public so that our local leaders would notice it and eventually do something about it. If they already have support of the local government, the local leaders, it is more it makes us more confident to implement programs. If our policy is simply like this, if it's not legally binded or no local policy about it, we are hesitant to do something specific to any concern. So that's on the local veterinarian's perspective. So you always should abide on the law or the local ordinances or executive orders like that. Thank you.
Thank you, Dr. Badiola. Is Prof. Latiffah, do you have anything before we close the Q&A? Anything that you'd like to add?
No, I think everybody have addressed the questions very, very thoroughly. Thank you.
Okay, thank you all again for the thoughtful questions from all participants and for these engaging discussions. We want to thank all the panelists for sharing their valuable insights and expertise. And we're very sorry if we didn't reach your questions because there were too many coming in and we are limited of time. So before we let Dr. Sejal go, can we take a screenshot, a photo first? Because we also have a very short clip from some fishermen on the ground about One Health after this. Okay, if you don't mind, could everyone turn on their camera and we'll just take a. You can see everyone's beautiful faces on the Saturday morning. It's morning in Asia.
Okay.
Mm,
3, 2, 1. Thank you, everyone.
Thank you, Angel.
Thank you. Bye. Sorry, I
Okay,
have to
bye,
leave.
Dr. Sejal. Yeah.
Bye.
Thank you,
Okay.
everybody.
And thank you. And for those who are still staying, we will show you a very short clip from some of the farmers, some of the fishermen in Malaysia.
Okay, so some of you may know we have solicited some videos for this one summit, and then this submission really struck to us, and some of the submissions will be posted in the Padlets as well. So I'll be playing this.
Oh, laut dah makin sempit. Lepas tu pembangunan banyak. Jadi susahlah nak mencari. Ikan pun makin kurang.
Keadaan ke laut ni makin sempit. Pendapatan pun makin kurang. Jadi tak larat nak pergi jauh-jauh.
Masalahnya yang pertama pencemaran alam. Pencemaran alam, selepas itu pembangunan. Banyak kapal-kapal buang bahan-bahan yang tak boleh dipakai, dibuang ke laut. Itu masalah untuk nelayan.
Masalah bangunan, hutan bakau semua dah ambil. Itu masalahnya, air kotor semua turun ke laut. Cemar pada nelayan ni.
Yeah, so that was a short clip that was actually submitted by Club Alami, which is a community organization founded in Johor. And they basically what they do is that they empower local fishermen to benefit from development. So making sure that they're licensed, they receive fair compensation and have access to government support, and also explore alternative income opportunities as the fish catch declines and the seas shrink. So right now we will take a 1 hour break where we will convene for a workshop to network, exchange, and discuss spillover intervention strategies for our regions. So we hope that some of you can join us later after this hour and we can have more time to chat. So thank you very much for joining us for this first session, and we hope to see you later.
Yeah, once again, thank you very much and see you at this time flash on your screen. And thank you.
Please feel free to use this. We will keep the Zoom on. You can communicate with other participants as well, and you're free to hang around. Okay, thank you.
Full break. We have a few people in the room here. Is it okay for me to ask all of you to open your cameras? I wanna, you know each other, introduce yourself. I believe you've already heard Marie over here, Marie Rachel Jane, Dean. If you guys are there, of course, we'll give it a few minutes until everybody gets back and they take their time. But in the meantime, for the people over here, Angeline, Shauna, Queenie, John, we would love to hear from you. Well, before we move on to our workshop. Perhaps they're still on their break, still sipping their teas.
Doc JP.
Hello. Who spoke? Sorry.
Queenie po, Doc.
Oh, Queenie. Hi, Queenie.
Yeah. Hi.
Would you like to introduce yourself to everybody here?
Of course, but I'm too shy to open my camera, Doc, since, being
It's
at home.
fine.
Okay, so hi, guys. I'm Queenie Maria Cadilla. I'm a former student of Doc JP when he was still teaching in CBSUA. And I'm so happy and thank you for the opportunity of having me here on the seminar.
Nice to hear from you, Queenie. And, so yeah, welcome.
Thank you, Doc.
How's your hobby in aquarium industry? You still doing some stuff with the fishes?
Yes,
Still keeping
and
them?
then yep, I still have two fishes, my apple snakes
Oh,
and
snakes, snail.
shrimps. I snail, sorry. Snails. I cannot afford to keep any snakes here on my home because you know
Yeah. So yeah, I hope you enjoyed the talks earlier. It's very inspiring.
Yes, Doc. Thank you po. Thank you so much.
Yeah. Yeah. Other people, if you'd like to introduce yourself, we'd love to hear from you as well. Then we have a workshop this afternoon. So it's a very casual workshop, just you know, sharing strategies and insights, and just we want to foster really communication, conversations, uh, between each other and build this network.
Maybe we can introduce more about ourselves.
Yeah, you're right. I keep asking them to introduce themselves. I didn't even introduce myself. So yeah, again, I'm JP Gonzalez. I'm from the Philippines. So I'm a veterinarian. As Queenie has mentioned, I was formerly assistant professor in a university in a province of Camarines Sur. And now I'm a private veterinarian and I work in a journal, which is the Journal of Visualized Experiments. So you, Chan?
And hello, my name is China Yang Sweet Bee. I'm based in Malaysia, KL. So I was a JP's co-intern in the World Organization for Animal Health, and I'm also a vet and from the Faculty of Vet Medicine, UPM, and I did my PhD in epidemiology and public health, where my main studies was about spillover of emerging viruses at the human and wildlife livestock interface. And I also worked a lot of qualitative work as well, trying to practice more of the social science methodology in spillover prevention. And I'm also working with Prof. Latiffah just now in the Lancet Commission for Prevention of Viral Spillover. We have a One Health working group, so we do policy reviews, we do qualitative interviews from like international, regional, and national representatives to understand what are the challenges in trying to implement One Health, because these are very contextual based, and most of the time, a lot of international guiding documents are may not be well applied in local situations. So this is part of my interest as well, really looking at how to translate policy into action and practice. So it's really nice to see all of you, and just take this session casually, no more speakers. And we can chat with one another as early careers. Angel, would you like to share more?
Yes, thank you. Um, I was just thanking Shona Thorne on here, who needs to step off shortly here because she's babysitting her very small grandchildren and multitasking like an absolute queen. But she wrote a summary of the talks earlier in the session and sent it to me. And she's just always been a supporter of EarthHug. So thank you, Shona. Just want to appreciate you before you step off. Yes, about me. I'm a PhD candidate here in Canada in British Columbia. And I work with Maya Gitzelson, who hosted the Turtle Island session yesterday. And we work kind of in like eco-health, planetary health more so than One Health, but in like the relational components of climate change. And so I work with a lot of young people on like enhancing eco-social health literacy and adding like ecological and human animal dimensions into our understanding of human health in like high school curriculum. So that's me. I don't know if anyone else wants to share. I'm going to paste Shona's summary in the chat box so you can all read it because it's very good.
Yeah.
Shona, would you like to introduce yourself? Maybe we can share a bit from you. Thank you for making the summary for the Asia session.
I think she might be wrangling them to bed right now. They
Ah,
showed up,
yeah, good.
apparently. But if she comes back, Shona, you're welcome to introduce yourself. Shona
Yeah,
works with
please.
Margot Park in northern British Columbia and wears a million hats, none of which I'll do justice. So I'll let Shona introduce herself when she comes back.
So please don't feel shy. Feel free to type in the chat as well if you're uncomfortable with opening your mics. But we'd really love to hear from you. And you could. Oh, I saw Rachel. Sorry, I got excited. Marie, Rachel. Hello.
So, hi everyone, I'm back. Hi, I'm Rachel. I'm actually also, I've known Doc JP for, I don't want to say how many years already, but he's my batchmate, my colleague. Just really happy to be here. And I think I met Miss China, Doc China like last year, right? So I'm just really happy to support everyone with your activities. By the way, I'm Rachel. I'm from the College of Veterinary Medicine, an assistant professor and dean in Central Bicol State University of Agriculture, and I just hope that my students will be challenging. I guess since I'm already talking, I've heard one of my students already spoke up earlier, and I hope the others will enter the workshop soon as well so that we could have great exchanges and just learn from one another. I mean, it's the essence of One Health, and I just hope that my students can do like, I mean, they're it's as Miss Doc Shine said earlier that being there, I mean, being exposed to different opportunities just give you this new perspective, and just learning a lot from one another is the essence of One Health. And I'm just really happy that Doc JP actually invited us, CBSEA, for this activity, and I hope my students can learn a lot from everyone here. So thank you.
Thank you, Dean. You wanna pass the mic? Anybody else who wanna? Raven, I saw you from the chat. Do you wanna introduce yourself?
Hello, can you hear me okay? I'm gonna turn
Yes.
on my camera, but I am red because I am a little shy. But I am very honored to be here. I'm calling from British Columbia as well, Vancouver, so-called Vancouver. And I've been following Earth Hug through all their sessions. I just been working with Angel Kennedy at SFU. Well, not really working, but I managed to take one of her courses and was just really inspired. And so when I heard about Earth Hug and what it's offered, and now I'm in the Asia session, I had this like feeling of traveling throughout the world and now hearing about the spillovers in Asia and how you guys are managing it and the perspectives. It's very interesting to see all the different perspectives. So I'm just here and I'm honored to be here, and I want to hear more and learn more and understand more in different ways. And yeah, I'll stop there before I keep rambling. But I'm very honored to meet you, JP, and China and Angel.
Thank you, Raven. We're not brothers, right? Because we had the same surname. Perhaps we could be long lost cousins, since you're from the Philippines too. So yeah, thank you, Raven. Nice meeting you and meeting you. Um, we definitely encourage everybody to speak up, but while we're building some confidence to speak up, I think China, you wanna talk about the workshop?
Yeah, so in line with our team of building resilience against spillover through Asia's lands, and we really wanted to foster this networking and collaboration among participants because this is one of the key goals for Earth Hub. So in this workshop, it is very casual, and what we want is designed to encourage interactions among participants, and when we want to uh, design interventions for spillover prevention. So we want to gain as many inputs, especially from the younger generation, on what is possible in spillover prevention. So at first, we're deciding to make a breakout groups if there are more people. But I think this is a very cozy space for all of us to just speak together. So we can discuss key issues and develop strategies later. And maybe later, I would start to post some questions in the chat as guiding questions for our conversations. So yeah, do you want to start that now, or have some more introductions?
Yeah, I
I
think.
think we should all introduce ourselves. Maybe we can share the Excel sheet. And what do you think?
Okay, I'll be sending a link in the chat. I'm sorry. And then over there, please write your names as well and your countries. I'll share it so you can see. So basically, our workshop will look like this. Do I? Okay. Here. So if you could have access to the link already, here we could see the members' names, right? So please type in your names, introduce yourself over here, your affiliation and your role. And yeah, I hope everyone can access it. So
And don't be shy to speak up.
if you couldn't type, or for example, you're watching on your phones or in a device, that's uncomfortable to type, just let me know. You could type in the chat or you could speak it up, then I'll type it for you. So please feel free. And if you want to turn on your cameras, that's perfect. So we have a few from Philippines and Malaysia.
I think we have someone from Is that Vietnam? Vietnamese.
Maybe Tan Trung Nguyen, are you there? Would you like to introduce yourself?
You could unmute to introduce yourself as well.
Yes, please. This is the group. We have a group now. So I'm sending a link in the chat. Here is it. Please access it. Then you could type in your name over here, your country, your affiliation and role. Or please feel free to turn on your camera and turn on your mic. Oh yeah, we are all writing under group 1.
Yeah, since this is just a small group between us, I think it's nice that we all work together on one sheet and just discuss among all of us so all of us can hear what each other has to say.
We have someone from UPOU. Hello, Kenneth and Angeline.
Hello po.
Hello po. You want to introduce yourself, Miss Angeline, Dr. Angeline?
Good afternoon, everyone. Okay, my name is Angeline, and I am currently a teacher and studying at University of the Philippines, together with my classmate, Sir Kenneth Manuel. And I have learned a lot about One Health, especially I attended the first session, which is from the Middle East, and I gain a lot of insights, especially into the indigenous worldview. And I think it's covered mostly on the topics including medicine, arts, humanities, and culture. And I'm grateful for this opportunity to attend in this Asia session. And I hope uh, to learn even more in this session. Thank you.
Thank you, Angeline. What's your field of profession? Sorry.
I'm teaching general biology,
It's
senior high
amazing.
school.
Thank you, and nice to see you here.
So let's go to our, throughout these conversations, we hope that you can share more about the unique context about your country because sometimes we don't know what is going on in different population, different groups, even in a single country, it can be so diverse. So feel free to share very internal insights or uh, more broader insights as well. So, when talking about spillover, we would like to hear from this group. What are the important disease or outbreaks of spillover in your country that that you think is very prominent that you can list down here in the Excel sheet?
If, for example, Rachel and Queenie, and of course, other people from the Philippines, we have a lot of diseases and outbreaks in our country. Mm, feel free to type in those that that comes into your mind. Definitely rabies, right? No, always think about it. In fact, if I could mention, if you've heard about this golden retriever, very popular case that got positive with rabies, it's from our province actually. So yeah, we have rabies, we have ASF in Vietnam, FMD, LSD. Feel free to type directly in the Excel as well. Lepto. Okay. So while you're typing, do you guys want to say, why this resonates in with you? Anything you want to say about the disease? For example, Queenie, you said leptospirosis and rabies. I mean, why are this the diseases that pop up in your mind, Queenie?
Sure.
Hey,
So,
I'm not your lecturer, okay? For here, we're just colleagues, Queenie, so relax.
okay, so just wanted to share about rabies because this month is Rabies Awareness Month, and I'm already a clinician here on our university in which we had a seminar and also an event wherein we gave out free anti-rabies vaccinations to the pet owners, of course, and that is one of the popular diseases that I think that is existing right now because um, it is widespread in the country. So, yep.
Thank you so much, Queenie. And we'd love to hear as well. Tan, is it pronounced it correctly? Do you wanna share something about the diseases that you put it?
So there is ASF, FMD, LSD, and rabies in Vietnam. Would you like to add any context to it? Mm. For Malaysia, maybe I will share. Actually, ASF is quite. We're having some active ASF outbreaks recently. Previously, ASF is not common in Malaysia, but sometimes we have occasional outbreaks and it is being controlled. But of course, farmers are very upset of that. And sometimes there was an article where these farms in a certain state was found to be transporting some of the pigs that were sick. and there were also from a farm with an outbreak, but was not reported. So this is one of the challenges we face as well. That sometimes farmers are afraid; they don't want to let authorities know about some of the disease outbreaks in their farms, so they transport the animals to other state, and it was caught during the borders at the borders. Another thing that was quite relevant to Malaysia is also rabies, and we have uh, we have been trying to eradicate rabies from Sarawak and Sabah area for the last few years, and it's quite challenging because in Sarawak it's most of the dogs are not kept in houses. They are free to roam, and their people are also staying very close to the jungle, to the forest area, and sometimes it can be also coming through Indonesia through the Kalimantan border. So, yeah.
Thank you. And if I can share also about ASF, actually, Dr. Rachel and I have published something about this because ASF in the Philippines impacts really everybody. It's not zoonotic, it only is from the swine, but the impact of it transcends both in to everybody basically, to humans and the environment. For example, veterinarians, veterinarians they are sometimes get a bad reputation because they do the culling. Some of them were bashed in social media. Some of them were threatened. Their lives were threatened. The traders, the pig sellers, their livelihood was threatened, or basically some even vanished. They lost their livelihoods, and this is not only a source of income for them. This is passion. This is their identity. Their mothers, their grandfathers, they were pig raisers, and suddenly they couldn't raise pig anymore. And some of them, even though these are pig for consumption, they treat them as companions. They cry when these pigs, when these pigs suffer or they die. The same time I mentioned about the environment, because at that time, the compensation for these culled animals were not enough. I mean, the farmers felt like they were not enough. So when there are signs, they would hide it and not report it. And eventually the pig will die and they'll throw it to the rivers. And the rivers got so polluted in the province. So, it's a non-zoonotic disease, cannot be transmitted to humans, but has impacted several contexts in the country in general, especially since, as you've heard in the morning session of Dr. Badiola, typhoons, natural disasters are a very common occurrence in the Philippines. In Bicol, particular, you get 20 to 40, 11 to 20. I'm sorry, typhoons in a year. So that's basically 1 to 2 typhoons per month, and all of these stressors are just aggravate how people respond to this type of outbreaks. Not to mention, even Dr. Sejal mentioned right about climate change. So it's nice that we could look at this as well. Um, yeah. Somebody introduce himself. Is it okay I read this? Ayon, or do you wanna uh say it? Send me a direct message. He's having difficulty in accessing the file in the iPhone. So feel free to just type your answers or you could let me know. So I'll put Thailand here. Do you wanna speak up, Ayon? Can hardly talk. I'm sorry. Yeah, sure. Sure. So I have someone from Thailand. Okay. Thank you, Ayon.
I would
You're
just like to add on to what JP said, and we can see that the social aspect in disease control is actually very important. And last time I also did a survey I did a qualitative studies interviewing. So as you know, Nipah originate from Malaysia, and the outbreak was very devastating because almost 50% of the industry that time was culled. Basically, pigs. 50% of the pig population in Malaysia was culled, and we had almost 2 million population before that. And after the outbreak, we only had about 1 million population. So in my study, what I did was to interview farmers who were farmers during the outbreak 20 years ago and after that. And even after 20 years ago, when they were discussing about and recalling about the outbreak, they were crying about it. We could see tears in their eyes, and it also impact the way that they make decisions. And for Malaysia, at least through my interviews, we found out that the private sectors were very important and influential in building these relationships with farmers. So, for example, these farmers may not believe in vaccinations or even disinfecting. Like they don't believe that it actually works, in killing viruses. But because during these emergency situations like an outbreak, and there are good relationships with the private vets, then they are willing to do all these good biosecurity practices. So I think as practitioners, it's also very important for us this kind of relationships with farmers and also helping them understand how diseases is spread and transmitted. Angel, would you like to share a bit about Canada? I think that would be very interesting. Although this is an Angel session.
Yeah. Sorry, we're in the same room, so I hear an echo. Um, not an expert on spillover events, but I've worked on a chronic wasting disease project, and then this is through what I've heard and then also looked up. But I know we have like avian influenza that comes around every year too. Lyme disease sometimes happens, especially in our like rural islands off of our coast and like heavily forested areas. We were actually running a field course and we had someone got bit by a tick during our event, so we had to send it in. And we have a pretty good monitoring system now where you just take a photo and you submit it and they know whether or not it has Lyme. So that's been good. And then leptospirosis. We have a lot of rats like in our downtown cores of Vancouver and Toronto, and after floods, especially for those like unhoused, there's like an increase. And then we have chronic wasting disease in Alberta and Saskatchewan with some of our deer. And LCM, although it's like pretty underreported, and we sometimes have West Nile virus in our marshy wetland southern regions. That's what I know, but I think there's a lot missing, so very happy to be informed if anyone has anything to add or change.
Yeah, thank you, Angel. Also, we oh yeah, Ion's having technical error, so he cannot speak up. But yeah, they're from Thailand. Through a student from UPOP, or the Open University of the University of the Philippines. So thank you for coming. We can move on to the next question. Oh, about the
Yeah, our
interfaces.
next question is about interface. Just to share, where does spillover usually occur in your country? Like, for example, markets or farms, even touristic sites. In Malaysia, we have a very famous cave site with it's called Batu Caves, and we have a lot of macaques, long-tail macaques over there. And there were some studies done as well on malaria for those population. And I also did a study on leptospirosis on some of the macaques that were caught in human conflict situations, and we found there were some past infection of leptospirosis in these macaques as well. So this can be some examples where spillover can happen to humans. Yeah. Feel free to fill in the form.
So leptospirosis is quite a popular disease in the Philippines as well because again, it's all connected to I mean, it's not just connected to it. It's just one factor, but again, we are very prone to natural disasters like flooding, and everything. Just last year actually, there was a big flood in the province. The flood reached as high as the roof. So people really had to escape and climb to the roof, second floors. This was around October, if I'm not mistaken. And after that typhoon, two or three more typhoons followed. I'm sorry, Bicolanos can correct me because I'm not sure, but it was a sequence of typhoons at that time. And of course, at that time, people worry about their lives, their livelihood, their houses. At the same time, we also worry about diseases. Leptospirosis cases uh, are there, because of the waste of the rats, which becomes interface for the transmission of this as well. Yeah. I'm sure a lot of you has a lot of experience with this, and yeah, feel free.
We have some answers from Vietnam who mentioned that ASF is throughout the country, rabies is throughout the country, but FMD and LSD is on northern Vietnam. Could you share why is FMD and LSD in northern Vietnam more?
Hello, can you hear me?
Yeah, we can hear you very well. Thank you.
Yeah, thank you so much. Yes. About the FMD, so in terms of FMD, so some outbreak happened maybe 7 months ago. So after that, we try to do the mass vaccination. So uh, after that, the outbreak now decrease now. So I think it okay now. But yeah, some outbreak will happen just like the biggest holiday, like the test in Vietnam, the Lunar New Year. So after that, so now it happened because we do the mass vaccination. And also for the AFF, so now many outbreaks happen in Vietnam, and that's why we have to like the cool many like the big herds, and that's why it can lead to increase the price of the beef in the markets. I think now very high. And also for the rabies, we also have some outbreak because we cannot do like the mass vaccination for the rabbit in Vietnam. So some cases in human also happen, yeah, throughout the country. And for the LSD also happen in some cow in the north of Vietnam now. So even we have vaccine now, but it still have outbreak. Yeah, thank you. That's
Thank you
all.
for yeah.
Yeah, that's amazing. And I actually want to add that, prices also, that's one perspective to look into because on the outbreak of ASF in the Philippines, the prices of pork was so fluctuating. And Philippines is mainly a pork consuming country, pork and chicken. That's our top protein commodities. So the prices would sometimes plummet because traders and backyard sellers just want to sell. So there's an oversupply. And then sometimes prices would go so up, so high because of the lack of supply. So it's just become the market at that during was that February 2020? Yeah, February. It was just so fluid and volatile and it's affected a lot of livelihoods and lots of things.
I'm just curious, Tran,
Yes.
like in Malaysia, for example, for FMD and ASF, there's a wildlife component to it because some of our wild boars had when we detected ASF in wild boars, and for FMD we detected in the wild cattle in the forest. So I want to know in Vietnam, is it that does it have the wildlife component in this livestock disease?
Actually, I think we have separated in the wildlife, and I think not they didn't combine together in the households. So I think it's not the main factor to lead to the outbreak. But for example, in Vietnam now, the AFF, even we have vaccine now, so we have two private company, they produce vaccine for the AFF. But I think the efficiency is still not so good. So that's why. And also like the AFF virus, so they have like the recombination of genotype 1 and 2. So that's why the efficiency of the vaccination is still not so good. For the NMD, I think for a long time ago, we inject just only one dose of vaccine. So I think the immunity of again the FME not so good. So that's why some outbreak happen. But after that, when we do the mass vaccination like the 2 dose, and we try to do the vaccination for all the A of the B, so I think it's okay now. Yeah, this my that's all. Thank you so much. Yeah.
Thank you. It's very interesting to hear because, it's so much easier to absorb when someone is telling you directly than when we have to read in the journal papers. Or
Yeah.
Angel, would you like
So
to share a bit? Yeah, sorry, Tan.
so I know Philippines also imported the AAF vaccine from Vietnam. So I want to know how about the vaccination in the Philippines. So can you say something about that?
Yeah,
So if you talk,
Tan.
yeah,
Thank you. Actually, I would say that right now I'm not much updated with regards to the status of vaccination and ASF. What I know so far, but this is probably outdated, and somebody from the Philippines can jump in, perhaps Dean. That yeah, we have a vaccine that came from Vietnam, and it was under trial last year. That's the last information I have. But I know that the government is looking into vaccinating our pigs using vaccine from Vietnam. So I really couldn't comment as much as I'm sorry, but perhaps other people in the Philippines have knowledge about
yeah,
this. Yeah, Dean.
yes,
Hello,
it's okay.
hi. Just like a month ago, we were visited by the center director of International Training Institute for Pig Husbandry, Dr. Ruth Glad. She shared that, well, I'm not sure if the vaccine was actually from Vietnam, but they mentioned that they had several trials about vaccine, of a certain vaccine. Again, I wasn't able to, it was just a casual conversation with her, but they were really happy about the result of the vaccine within their center. They actually have a demo farm there, and they said it was effective for them. Uh, but we're still waiting for for what do you call it, the rollout of the vaccines to the different provinces, and hope that uh, it would have a positive result as well. ASF, just recently we had like, sorry, can I call it this, like a second wave of infection? Recently, some of the provinces are, we call it like red zones if we have an active infection within the municipality. Then after like several months of surveillance, they could, if there are no active cases, they could apply for pink zone. So it will like lessen the like the active cases. And we were monitoring. I actually have like my thesis advisees trying to monitor the cases of ASF here in Bicol. It's our province here in the Philippines, and it's been going up. So I think we have lesser cases for now, and I hope it continues for the next months, because definitely it is a good good news for the swine industry here. So I hope maybe you could also share your experience with the vaccines there, and hopefully we could it has like positive results for everyone. So yeah, thank you.
Thank you, Rachel. When they said that, did they ever mention how did they figure out it was effective or They just said it's effective, or did they give any details about that?
Yeah, it was like, yeah, it's just like plain
They just said,
positive result. But I think they did a presentation, like a public presentation, but I wasn't able to attend, and I wasn't able to, get any link, or I'm not sure if they're going to publish. I asked Doc Ruth if they're going to publish the result, because of course, with our ongoing project with ASF, we was really interested of the result, if it could also be helpful for our communities here. Just actually here, my actual municipality, Pili, we are still under red. So we're hoping, if if it could have a rollout here in the Philippines, in our province, maybe it could also help our swine farmers, especially the backyard ones, just to prevent any more deaths for them. So yeah, thank you.
thank you, Rachel.
And I think Rochelle, Dean, she asked if how is the vaccine? ASF vaccines in Vietnam, right? Maybe Tan, you can jump in.
Actually, as I mentioned before, we have two private companies. They have produced the vaccine. The first one is from the AVAX, and the second one maybe from the state company, the public company. So they call in the Navesco. So they also try to make the line of vaccine from they use I think they use the one virus with the delisting from the US. So they try to make a vaccine. So at first, at the beginning of the stage, so it's effective. I think it have some like effective, but later when some scientists they detect some like the recombinant viruses. It means it can combine the genotype 1 and genotype 2. So I think one paper also mentioned about that the results is not so good for the current vaccination. So I think now the two private companies, they also try to upgrade the vaccination. They try to make the good vaccine, and you try to adapt to the current situation to get the good one. I hope in the future. So, but for the AMF is also very complex. The virus is also very like the 24 genotype, and also they have like the rapidly mutation. So all the things that I think it lead to very difficult to make the good one to do. So, but anyway, when they use the live vaccine, so they also have to like because the virus can release to the environment. So I think it can make it can contribute to like make the not so good the vaccination nowadays. Yes, that's all I know. So thank you.
Thank you. Thank you for the exchange. Angel, well, limited of time. Angel, would you like to share just a quick share about what you wrote?
Yeah, I don't need to take a lot of time, but I was just thinking about what you were saying, JP, around how after floods, you had like increased rats, and we have the same thing after our rains in like our downtown core. And so just thinking about how when we zoom out and think about how like human animal interactions and environmental events and all of these things are connected, we actually see more connections between like countries' experiences too with things. So I just started linking it to what we talked about in the Europe session about fuzzy cognitive mapping and systems thinking, and also how the social determinants of health really affect the human experiences of these spillover events, knowing that where I live, there's a lot of privilege, and then there's also areas where there is not. So those experiences of these spillover events are very different, and just wanted to note the equity dimensions of it a little bit.
Yeah, I think that's really important. Moving to the next question, I think we have briefly spoke about it as we were sharing the experience about these diseases. What are the factors that influence spillover? Maybe we can quickly just type in and yeah, go on it briefly.
And after you type, you could take a check mark if you think it's applicable to your country too. For example, somebody typed in a factor that you've thought about, just feel free to check it.
While everyone is typing, I just want to share something as well from one of my studies where one of the it reminds me when I'm answering this question on factors that influence spillover. It's the development policies as well. So when I was interviewing the farmers, and so Nipah was suspected that it came from a bat dropping and fruits from fruit bats that eaten a fruit in a farm, and this fruit fell into the pig pens, and then the pigs got infected by these bat droppings or the fruit that was consumed by the bats. So when we were asking the farmers what did they think about this transmission and how would they locate the farm? So most of them share that actually they are very threatened by the development, and most of the time it's very hard for them to improve their farms because improving the biosecurity sometimes it takes millions of dollars, and most of the pig farms in Malaysia are open farm systems. So if they want to change it to closed house systems, which is better in terms of biosecurity. But in doing so, they are threatened by these development policies where uh, the more and more modern buildings are building nearer and nearer to farms. So it's very hard. They feel like their future is not permanent, like their farms will not be there for a long time. So they're not willing to invest in this biosecurity practices or infrastructure upgrading. Yeah, and we're seeing some answers on weather for Philippines, Malaysia, Canada, Vietnam, and there is climate change also and deforestation, forest fragmentation, human-animal connections and relationships, and just now about vaccination, which is a very uh, important intervention at the spillover interface. There's also infrastructure, human movement, yes. And for example, for human movements, some of the risks that, especially in Southeast Asia, we have a lot of boats that are going from one country to another country. So sometimes rabies dogs or even pathogens can spread very quickly from transboundary borders. Yeah, habitat loss, trade and global travel, socioeconomic factors, and behavioral factors. Yeah.
Yeah. Yeah, since trade was mentioned here, actually, when it comes to trade, you don't only trade, I mean, especially for those illegal or unmonitored trade, not only the animals are traded, even the pathogens of these animals, are traded. If you know what I mean? Because some of this, unmonitored, unregulated animals that are in trade or wildlife trade, they carry pathogens as well. I believe there was a case where a pathogen of a bred lizard or a domestic lizard was spilled to the wild lizard. So I'm not sure, was it in Thailand, Ayun? I'm not sure, but yeah, there were cases like this as well.
Yeah, and just to top up about trade as well, my one of our parasitologist lecturer always mentioned that the zoonotic malaria, which is from the long-tailed macaques, originated in Malaysia. Plasmodium knowlesi is the most exported exported item or across the sea from Malaysia to other countries. So yeah, we're not very proud of that, of course. So let's go on to our next question. So after having an overview of what are the important spillovers and the interface, as well as listening to what the speakers have shared earlier, especially, Dr. Sejal mentioned a lot of community interventions. How would you think, what would you think is the best way to prevent or reduce spillover? It can be very specific to your context, and that is okay. Basically, we want to just keep going up the chain. What is the root cause? Consider all levels, all the entire systems from environment, social economic drivers, changes in governance, technology, legislation, community behaviors, or any gender associated risks. So be be creative about this and just yeah, have your time to fill in this what can we do part. Thank you.
Who wrote Rethinking Relationship with Animals? I think it's a very thought-provoking. Oh, it's you, Angel. It's very thought-provoking. It's a very thought-provoking line. I mean, do you wanna, expand on this?
Yeah. So I have done some work on Cortez Island. It's like a little remote island, and um, the community found that when they were like trying to remove all the cougars from the island, there were all of these like other unintended consequences that came with that. And so then now they've started working on coming up with a way to like coexist with the cougars, and they have like all these programs and initiatives and training programs, and it's been going really well, and like the ecosystem is healthier, and so they've just reimagined their relationship of not viewing like these predator animals as predators or as like things that they can't coexist with, but instead reimagining that relationship of coexistence and like moving away from anthropocentrism and all that.
Yeah, that's amazing.
Yeah, I think it was also interesting. Just now, Dr. Sejal said that her context in India is opposite from Mongolia because Mongolia there's a white space, more livestock than humans. But in India, they have a huge, rich biodiversity, but the population is massive as well. So it's very interesting to see this context and how do we actually coexist with wildlife? Like, do we need to cull them? Do we need to live separately from them? Like, yeah, what do we actually do to coexist? Yeah. Do you have any thoughts on that, Tan? Dr. Tan?
Yes. So in my case is so for me I think we should do like the enhance the like the enhance the knowledge of the farmer, because when they get the knowledge, so they know how to do and they know how to prevent the disease, how to control disease. And when they have like a high awareness, so I think they will do like proper biosecurity, they will do the good vaccination, they will do the good selection of the breed, and they also know how to care about animal, how to do the like the welfare for animal. And I think all the thing will lead to like the 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 goods product to sell, or the good product to get to earn the money, or to earn the benefit. So I think it's also very important for that. So just in my case, thank you.
Thank you, Tan. We also have something about transform urban planning. Interesting as well. Can I know who wrote this? Maybe you can share more about this thought. Transform urban planning. Oh, that. So, transform urban planning. I was kind of captured by this, by this, by this answer because in my recent reading about Singapore, unfortunately we don't have Singapore participants here, but I understand that they Singapore is a very highly urbanized island, and they are really trying to um, live and coexist actually with nature. And in the city itself, they have a lot of wildlife, you know, from snakes to otters to wild birds and bats. So this is partly in their policy. And sometimes when talking about interventions as well, there are community interventions, but many of the times we need governance and policy and even legislation to support that, to provide resources, you know, financial resources especially. And in many of our Southeast Asian countries, at least, a lot of these initiatives around spillover are usually funded by developmental partners like WWF or USAID Yes. And going forward, since now we have experienced, especially with CEO who have experienced some of the budget cuts from US, so it's definitely something important for our region to continue to build resilience and engagement with communities to improve spillover interventions. Yeah.
Yeah, and also this awareness and knowledge has also captured my thoughts because especially since we have a lot of we have a few lecturers and students over here, and of course, awareness and knowledge. It's one of our goals sometimes in the university, to do extension programs. And I would say that where I'm from, there's really high number of misconceptions, and we've been battling it over the years. I guess, some of the lecturers here can attest to that. If you want to share that, Rachel, do you want to share about that since I know you've done so much work as well in awareness and extension campaigns.
Yeah, yeah. Thank you so much, Dr. JP. Actually, at the university, we do a lot of extension work, really more on raising awareness, really improving those myths, just battling those myths. Like, just recently, I went to one of the municipality to conduct a seminar and just a simple like interactive activity with the participants, and like half of the questions which are actually false about rabies, they said yes, that's true. And it's really uh maybe it really how could I say this, that I guess it's just a push really for the college that, oh, we really need to do more of this work, because there are still some pet owners that believe that a lot of misconceptions about rabies, and it's just that we need to do more. We have to tap a lot more of local government units, as I think mentioned earlier during the seminar. Really collaboration is a key to battle these misconceptions, because actually just for our recent like talk with my students here, actually when we were thinking about the theme that we will be using, we opted to use like safety through awareness. Like it's the theme that I just really appreciate that. Oh yeah, I mean rabies wise, or even food related, because I was also handling the food safety and hygiene subject right now. And like yeah, safety starts with awareness, and it's a good thing that I hope that our participants for those activities learned from us. And we started with students. We have those with high school students, and one of the main topic there is to not just the students to be aware, also their family, but is the nucleus of unit of the community, and just share it among their friends, among their families, and just have more students, or have more people aware about this, and hopefully we could, lessen the cases of these diseases. So yeah, I really again, this activity is really amazing that we could share this perspective with one another. I mean, we have different cases of diseases, and it's just good that we could learn from one another. So thank you, everyone.
Thank you, Angel. Okay, if we have not, thank you, thank you, Angel. Thank you, Rochelle. If there are nothing else from other participants to add, okay. So let's conclude our workshop. So it's been an hour, and thank you very much for the incredible engagement. It's a very cozy session, and we hope that you also enjoyed the meeting, especially this morning, and hearing from the different speakers, and now speaking together in this small group. Thank you so much for staying throughout this Asia session. And it's been very inspiring as well to hear from all of you as we continue to explore how to prevent and reduce spillover through the Asia's unique lens.
And of course, as promised, since this Eco Global Summit is an annual thing, we're pasting in the chat a post-session form where there are some questions to ponder about. And so please type in your answers, as well as you could also request your certificates over here. There's also a feedback form there, of course, if you want to share some suggestions or insights or the topics that you want to be discussed next time. So again, we are very grateful of your time. Please feel free to bookmark this link. We leave it open for I guess 24 to 48 hours. So yeah, thank you.
And thanks, JP. So to wrap up the Asia session and Earth Hub 2025, I want to invite Angel again to provide a synthesis of today's 4-hour long discussion and to officially close the Earth Hub 2025. And it's been an honor to host this vibrant and thought-provoking sessions from JP and I. And we hope that these connections that we've built will hopefully lead to lasting impact. Angel, the floor is yours.
Oh, thank you so much, China and JP, for hosting the session and for your leadership this year, which has been just amazing. I'm so proud of you both. So I just wanted to take a moment to thank you all for coming and to really honor what we did over these past 3 days together. It's been 28 hours of hugging the earth and talking about working together for a healthy, just, and sustainable future. So I wanted to read just a little poem and then just provide some final remarks just to thank all of you and anyone who's watching this recording who's joined the sessions over the past few days. So this is an excerpt from a book called Letters to the Earth, Writing to a Planet in Crisis. Dear Earth, I want to remember the feeling of my feet in soil, the weight of grief that doesn't crush but compels, the breath that links us. I don't come with solutions. I come with open hands. I come with love. And I feel like that's something that all of you have really embodied over the last 3 days. It's really hard to find the words for what this space has been, but over the past few days, we've really traveled across continents, across disciplines, across experiences and truths. And in doing so, we've held something really powerful. In a time when the world feels fractured and heavy and full of uncertainty and crisis, we chose to come together. And we chose to gather not only in conversation, but in connection, not only in knowledge, but also in care. And as you know, we call the summit the Earth Hug, and that name has always felt like more than just a metaphor. It's really a reminder that amidst the disconnection, we can still hold each other. Even across time zones, borders, and silos, we can find ways to connect. And that we can still remember the Earth, still choose hope, still choose to feel and keep showing up for each other. This work isn't easy. In fact, it's often heartbreaking. It asks us to confront injustice, to sit with uncertainty, and to push back against the systems that isolate and extract. We've talked a lot about that the last few days. It asks us to stay vulnerable in a world that tries to harden us. But I think one of the gifts of this space and of all of you is that we don't have to do it alone. And so to every speaker, participant, listener, and quiet presence in the room, thank you. Thank you for bringing your insights and your heart and your questions and your truths and your witnessing and your knowledge. To all the co-planners, those who dreamed, organized, held space, and made this possible, your care and labor is felt in every moment of this gathering, and I've really appreciated it. and Earth Hug wouldn't exist without you. You held this space with grace and love and thoughtfulness, and I'm endlessly grateful to be building this with you. So, Evan, Carlos, Chester, Christina, Halase, JP, and China, as well as Mona, Alex, and Eric, thank you. I can't thank you enough. So, as we wrap up, may we leave here with not only the new tools and connections that we have, but also with a renewed sense of belonging. What we've learned over the past few days is that climate and health are not only about policy and systems, but about relationships, about reciprocity and love, inner peace, and finding joy in resistance, about transformation, about not leaving anyone behind, about challenging power dynamics, about systems thinking, about community, and about each of you, and honoring all of your ways of being and knowing. So as we move forward, may we find small ways to keep hugging the earth, each other, and ourselves in all the ways that we teach and build and resist and heal and care and connect. And I am so excited to connect with you all at next year's event. And I'll be in touch with some follow-up outputs from this event, but just have a lot of appreciation for all of you. So please go well, and we will see you next year, hopefully. We'll be here holding space, so thank you. China, JP, do you want to say any last things to end your session? I'm good.
Yeah, thank you so much, Angel, for having us. And we're also really grateful for everybody's participation today. And just really, it's really nice to be here. Yeah.
And it's nice to have this concept where, of course, we have many, many webinars available to us now. We have many, many, information, yeah, seminars to attend to. But it's nice that in these sessions that we have over the past hours, we emphasize more on the relationships, on the networks that we could build, and the care and passion for these concepts, and not just the technical aspects, not just the theoretical aspects, especially since again in this small group we have a few lecturers, we have a few students, and it's really a work of passion, and that goes to spillovers in general. So again, we're very glad to be hosting this session, to be moderating this session with the team and everyone from NEO. And I can't thank you all enough. And for everyone watching this recording as well, thank you so much. And hopefully see you next year.
Hey, have a good weekend, everyone.